In this video we're going to cover off one of the things that we've done in our previous videos, which is a technique to try and improve external rotation of the shoulder. Now naturally, if this movement is limited, there are some good exercises that you can do, and we'll put a link in the description and some videos at the end to show you the good rehab exercises. But in terms of massage and soft tissue therapy, here's a few things you could try. First of all, have a look at your patient's external rotation. So that's bringing the arm out this way into outward rotation. Have a look at what they can achieve before your treatment and then compare it to what they can achieve after your treatment. Here's a few things you could try. As you're doing the massage movements, you want to be trying to bring the arm out into external rotation. This movement here will start to stretch the pecs. So I'm going to come in over the top of the pecs there, pressing in just over the anterior arm, heading towards the sternum. And as I do that, I'm going to bring the arm back into as much external rotation as is possible for the patient. So just showing that again, locking in there over the pecs, and then bringing the arm out into external rotation as far as is comfortable. And that will create a shearing type of massage, like a pin and stretch, to start to open up that external rotation movement. If that's not possible, I may be in here because the patient's shoulder is tighter, and I may be working from a lesser angle trying to improve. If the patient's more mobile, I may actually be out here in more abduction, more external rotation, and beginning the movement from this position here. So we need to adapt it for our patient's current level of mobility. The next technique that I've shown in some of the longer videos is this one. Bringing the hand over and scooping over the upper arm whilst bringing the arm into that external rotation position, or as far as is possible. So starting here in internal rotation, scooping over the arm and bringing the arm round into as much external rotation as is possible. Now when you do this, you feel like you want to have bigger hands so you can really get enough purchase and contact on all of the soft tissue around the upper arm. So here's a solution for that. You want some extra grip. So I like to use one of these rubber compression bands, commonly known as a floss band, to wrap around the arm. And guys, I'm not doing this for compression. I'm not doing this for compression. I'm doing this in order to grip all of that soft tissue around the upper arm. So I'm just going to finish wrapping that around. Now when I grab a hold over the top of that band there and I move the soft tissue, it moves all of that upper arm soft tissue in medially. So with the arm starting in that internal rotation position, grab a hold of all of that soft tissue with the extra grip through that compression strap there, and then mobilize, bringing the arm out, mobilizing that soft tissue in. Really enhances the technique with the extra grip. So this I'm using here is one of the floss bands from Rock Tape, but you can also use some silicone sheets, and some of my colleagues have used some silicone sheets commonly used for baking in order to get the extra grip on the skin and to mobilize like so. Okay, I'm going to leave that in place there because it's not compressing, so it's not causing any discomfort. And another technique, we're on a cupping course today, so we can use a cup to grab a hold of that soft tissue and to lock in over the chest there. And then as we bring the arm into external rotation, I can mobilize the soft tissue in that inferior direction using the cup. Okay, start that a little bit higher. External rotation, and push that cup down inferiorly to create some torsion. Inferiorly to create some shearing force as the arm comes out into that external rotation. Finally, I want the patient to be doing some home exercises which are based around external rotation. So what I'm going to do is hold the band, rotate it in medially, and then ask my patient to externally rotate his arm. And the resistance is coming from me mobilizing internally, but it's starting to educate them on the movement that we want them to do for their home rehabilitation. And relax. Once again, mobilize, and the patient then actively externally rotates So we're working against each other, but he's starting to learn which muscles we want him to engage. And then we'll build this into his home rehab program. Next, watch one of these videos on the screen here so you can see some other techniques to help with shoulder mobility and increasing the range of motion. Thanks for watching.